Now for the demonstration of fish hook removals. This demonstration will perform the needle cover method and the advance and cut method. There are multiple barbs on the market, so the type of fish hook is super important to know, as you have a single barb, you can have a multiple barb, and you can have treble barb. On our table, we have an example of the treble barb and a single barb. When you look at those barbs, the type of fish hook definitely needs to be taken into consideration prior to removing these fish hooks. Prior to starting the removal technique, we definitely want to perform a neurovascular assessment, making sure that the patient has a good range of motion of every finger, including extension and flexion, can move side to side, and that capillary refill is intact and there's no numbness and tingling. Just know a subjective report of numbness and tingling does not stop you from removing the fish hook. However, if a patient is having trouble with flexion and extension, you have to consider that the fish hook may have penetrated either the tendon or the ligament, and the advanced or expert technique may be needed and consultation may be needed. So first we gather our supplies. We have a 18 gauge needle, we have gloves, iodine, lidocaine with a needle, lidocaine is already drawn up, saline, gauze, a band-aid, and then different type of pliers, as well as our trauma shears. Now, I would recommend obtaining you a pair of either combination pliers, the needle nose pliers, or the diagonal pliers. This is an example of the needle nose, and this is an example of the diagonal pliers. And so these have good strength to cut the barbs. Also, your size has to be taken into consideration. There is quite a bit of strength that is needed to pop either the very end or the tip of that fish hook. And so just keep in mind, if you don't have the right tools, you will not be able to get this fish hook off. And some of the miniature ones will not give you enough strength in order for you to be able to do so. So please know what supplies are available in your facility. So first we'll start by performing a digital block of the finger. We want to have the patient place the hand palm down, as we'll use the dorsal approach to do this. Let's perform hand hygiene and put on our clean gloves. Once our gloves are in place, we want to talk the patient through the procedure. So for the purpose of this demonstration, our patient's name is Susie. Miss Susie, I'll do a digital block on your fingers. We have 2 fish hooks in place, one in the middle finger and one in the thumb. So we'll perform a digital block on each using the dorsal approach to do so. So first, we'll take our iodine and clean the areas really well. And so I go right into that web space and get in there and kind of have them spread if they can and really get in the middle. Spread if they can and really get everywhere we gonna inject. And then do that again. It may be prudent to go ahead if the patient comes in and their hands are sticky or dirty. You want to go ahead and just have them wash with soap and water really well on the areas that are not around the fish hook. Once this dries, we want to go ahead and perform our digital block. So dorsal aspect requires us to use the 2 and 10. So if we place a clock on this finger, we want to inject at the 2 o'clock and 10 o'clock positions for both of the digits that we are removing the fish hooks from. Remember, we go straight in. You tell the patient this is lidocaine and it will burn. Burn lasts anywhere from 30 seconds to 2 minutes. Ready? Let's go. We puncture the area. Remember, superficial first, because the first nerve supply that we are anesthetizing is our dorsal nerve. So we want to aspirate and then inject maybe no more than 1.5 of the lidocaine there. Avoid epi, as epi is contraindicated in hands. Then we push on through to our palmar nerve. We aspirate, make sure there's no blood flash, and then go ahead and inject another 1 to 1.5 cc's of lidocaine. Then come out. Opposite side, now we are at the 2 o'clock position. We want to go in, aspirate and inject, and then proceed down to our palmar nerve, aspirate and inject. Same for our thumb. You want to get in that web space. Insert, aspirate and inject, and then move on down into your palmar nerve, aspirate and inject. Opposite side as well. Insert, aspirate and inject, and then proceed on down to our palmar nerve supply, aspirate, inject. Now, the number one question some of you will have is, I don't know how far to go in. That will come with experience. Just remember, the first, in order to anesthetize your dorsal nerve, it is superficial. Palmar nerve is more, you must advance at least, I'm gonna say maybe 0.3 to 0.5 to be specific, but not to puncture through the skin, if that makes sense. A pearl is to have the patient put the hand in the dependent position while they're sitting upright, massage the fingers over where you put the lidocaine, and then allow the patient to sit for a full 5 minutes. Once they sit, now we want to check and make sure our anesthetic is taking place. How do we do that? We just give that fish hook a gentle tug, and patients will say, well, I don't feel nothing, then you know they're ready to go. So our first, we'll take an 18 gauge needle. We are using that needle cover method. You want to go in the angle toward the needle so that we are covering the needle. So imagine our fish hook is here. So let's simulate this. Bevel down, because we are covering this part of the needle, and that's how we get the fish hook out. So your goal is to follow the track into the same hole they have and cover this barb and facilitate pulling it out just like that. Again, this simulates our barb. We go right into it and cover that area. And once you gotta actually lock it on there. There we go. And then we pull that back out. So let's try it. I would have the patient hold this finger down where you can get it out the way. You want to follow this right in here. Get right on it, and you can feel it once you get there. Then secure it, and it backs right out. Okay? Be careful. Now, both of these are very sharp. So if you notice, I kind of tucked in the needle and made sure I pulled straight out. Make sure y'all see. So you want to make sure that way your finger, this is not, because this will create a knife motion. And so you'll definitely puncture your finger if you do so. Okay? All right. Next method is our advance and cut method. So think about the type of, it would always be so much easier if they brought in an extra fish hook. That way you can kind of make a visual note. But you have to get in your mind how the fish hook is placed in, right? So right away, if I wanted to advance this through, I know that this should come straight out superficially. So you want to go ahead and push that through, right? Because this is the advance and cut method. So this is where it gets tricky. You want to take your pliers and you just squeeze, squeeze, squeeze until you hear a popping sound. And then you're able to back it back out, and it should come right out. As long as that piece has been popped off. Remember, that will come off. Just for the presentation, we were unable to completely cut this off, but this tip should be completely removed, and then it just advances right out. Now, you want to irrigate this pretty well. Let's clean it up pretty good. Remember, a finger can get infected, so we want to flush, 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 flush. Really wash. You may have some bleeding. Remember what the finger could do before. So if it had good range of motion, it should have good range of motion in and out. You should test flexion and extension of the fingers involved. They should be able to move it, flex and extend. So say after they can extend, but they're unable to flex. You don't want to create a contracture deformity, so I would splint this patient and definitely refer them to a hand surgeon. As a removal, this is in your wrist, so we definitely need to always inform a patient that while trying to get this out, sometimes you can get a little bit of injury to the tendon or ligament, and if that happens, they will be referred to a hand surgeon. So in this case, they have good range of motion. We put on a Band-Aid after we've irrigated and cleaned, and we are good to go. There are different antibiotics used to treat these. Now, you must practice prudent medicine, so if a patient tells you that they were in a certain body of water, you must prescribe the appropriate antibiotics, because you will be liable if they got a hand infection or if you treated the wrong organism. So please make sure you have a list of the organisms by antibiotic and how to treat them. If a patient is unsure of what body of water it is and this information is not readily available to you, I would treat them for both freshwater and saltwater organisms and kill one bird with whatever the antibiotics are needed to treat both. You do not want someone to get septic from a hand infection, and one of the consequences of not treating this appropriately is they can become very sick and possibly septic.
Hey, thank you so much for watching. If you enjoyed this, there's plenty more where that came from. Be sure to check out similar videos on our YouTube page. And don't forget to like, comment, and subscribe, and we'll see you next time.